the position that we're in to continue to solve really challenging problems of workforce burnout, continuing, aging population, chronic disease, all this Molotov cocktail of situations that make it a really challenging place to work. I think that's something that I feel like bringing together those different parts and helping tell those stories and make those connections and help people learn about the space more too can play a part in seeing some of these innovations come through and in the end help more patients and help us be more happy and healthy. And it feels like I'm contributing something meaningful to society.
Yeah. Peter Birch is a director of MetaOptima and the Medical Software Industry Association and has his own podcast on a similar topic to this called Talking Health Tech. With over 7 years in the healthcare industry and having also helped to create multiple health tech platforms, Peter can offer insight into what it means to be a future-focused health expert and how to make healthcare accessible for everyone. Welcome to Hacking Health. This podcast is for future-focused health experts, thought leaders and change makers who are interested in making health accessible for everyone, because together we can get to the future faster. Tell me about what it was like meeting Jacinda Ardern.
What an opportunity. So a bit of context. That was at a New Zealand trade delegation visiting Australia, and I was in Sydney, and I was just excited to meet some health tech companies that were visiting Australia. And then next thing you know, Jacinda's walking around and chatting with people, and I got to take a quick photo and have a quick chat with her. And she's like annoyingly always like, I'm going to say not perfect, but just like genuine. And I say annoyingly because, as a human, sometimes you're like, well, you're on and then you're off. Watching her between sessions and seeing her engage with everybody at the event, it's kind of like, I want to be like Jacinda when I grow up.
Yeah,
that was a really good experience.
So I'm curious to know, what was the process you went through to start your company, MetaOptima?
So MetaOptima, I'm the company director for the Australian subsidiary.
Right, exciting.
And the company was originally founded out of Vancouver. Mm-hmm. And every time I say that, I have to use my bad Canadian accent. But I founded in, because that's important. So, but as the first hire here in Australia, I was responsible for setting everything up and building up the team. Because obviously the technology that it underpins MetaOptima is all about helping doctors diagnose skin cancer using artificial intelligence, which is obviously a really important problem to solve here in Australia. And so my job for the last couple of years was to, establish the business, find the office, get the hires, sell the software to clinicians, sell the dream, then service it, fix the Wi-Fi, make the coffees, do the whole kind of kit and caboodle.
You also have a podcast, Talking Health Tech.
Yes.
What are you trying to achieve with that? Tell me about it.
Sure. So this started up on the side. I've always worked within healthcare and technology for my career. I'm not a clinician and I'm not a software developer. I get along swimmingly with everybody, but always worked within healthcare. And, back in 2018, I was looking for podcasts to try and get a better handle of what's going on in digital health in Australia in particular. And there were some good podcasts in the US and the UK, and those were really helpful. And a lot of those are still going on, but it's kind of hard to put it in context into what's happening in Australia. And you would know the same as well. There's good global information, just like, well, what about Medicare? And we're a very big country geographically, and we're spread out. So how does that work with rural and remote? So I had a background in community radio and had done a couple of other podcasts that were awful prior to, or it's just on the side, just for a bit of fun. And so I channeled some of that experience and those learnings and thought I'll start up this podcast. It'd be a nice way to connect with people kind of between things while I continued my day job. And the short version is it's now my full-time job. It's now my day job. So it's grown from being this little podcast on the side to now over 315 episodes, over 200 and something thousand downloads, and this great community of people who are passionate about solving big problems with technology and healthcare.
And healthcare is so highly regulated. it's so important to have that regional specific option for listeners.
Right. Yeah. And so there's some good nuances in Australia. And one of the driving reasons from the start of creating the podcast was, you knew this as well back in 2018 and prior to that, it was an industry that is remarkably important to everybody in the world. However, there wasn't a great deal of interest into investment into the innovation behind healthcare. And one of the biggest opportunities for innovation in healthcare is around technology. So, everyone was kind of operating their own little silos. The GP speaking to the GPs is very generally, but GP speaking to GPs and the software vendors speaking to software vendors, startups to startups, et cetera, et cetera. And I thought, well, a podcast is a great way to speak to anybody. It's accessible, it's free, it's engaging to hopefully, if you do them well, listen to conversations about topics that are related to your interest, but might broaden your thinking. So if there's ways to help improve collaboration within the industry, be it one conversation at a time, that would be the role of the pod. And I think we've started to achieve that and we'll continue to do that. We drop 2 episodes a week and we're doing all sorts of new innovative things to try and reach more people with video and other bits and pieces too. So yeah, it's a lot of fun.
Yay. It's community engagement, really, bringing all the pieces together.
Absolutely. Community is really important to everything we do at Talking Health Tech too. So the podcast, what originally just started as the podcast, the podcast is kind of the way that most people hear about Talking Health Tech and the things we do, but we've got this community over 100 organizations and a couple of hundred individuals that have joined the THT Plus, which is this community offering that we've created, which is then helping people kind of take things to that next level and connect with each other. And learn and grow, all centered around technology and healthcare. And it's interesting seeing, through the last couple of years where everything needed to be virtual, that was great to help, people connect in times where they wouldn't otherwise be able to, bump into each other in trade shows and things. But if anything, like each month is a new, I guess, personal record in terms of downloads on the podcast, and it continues to grow. And I think we're reaching even more people now that we're much more out and about and doing things as well. So it's certainly a thriving time for Talking Health Tech, put it that way.
Yay. You're part of the Medical Software Association. You're a director. So I guess that's really helpful for the Talking Health Tech business. But how did you come to find yourself in that role?
Sure thing. So the Medical Software Industry Association, for those that don't know, exists for those companies that are creating software in the healthcare space in Australia, but also in New Zealand as well. And the software in healthcare space is an area that I'm probably most familiar with in terms of my actual experience as a vendor and working within the space. But I also used to run GP clinics as an operations manager and general manager, so familiar with the software needs there as the healthcare provider too. So my role as a director on the board of the Medical Software Industry Association, the reason I'm there is actually because of my role with MetaOptima, as MetaOptima is a member of the MSIA, and I've been elected to the board to represent MetaOptima on that board. So that's the whole kind of background there. But what's interesting is seeing the nice crossover, because the MSIA does a really good job at advocating for those vendors that are creating software in this space, because often from a vendor's perspective, you might think, well, this could help solve a lot of problems. However, wouldn't it be nice if the government knew about it? Or how can I find out ways to build advocacy to get funding for this, or break down some otherwise insurmountable kind of barrier? And the MSIA is essentially where, the other groups like the TGA or the ADHA, so the Therapeutic Goods Association, or the Australian Digital Health Agency, when they need to speak to software vendors or the industry, they go to the MSIA. So I guess we've got that
peak body
ability of being that voice for the vendor community within the health space. Yeah, exactly.
Yeah. What drives you to get up every morning?
My 3 children who put things on my face to wake me up at inappropriate times. That's that's probably the first physical thing that will wake me up in the morning. But that's, in terms of what we're doing at Talking Health Tech, it's exciting. It's a range of emotions running your own show. Also, as you know, like in terms of running your own business as opposed to just being employed by somebody, which is still an important, super important role to have. but that's certainly turning new gears for me. And that whole constant learning piece is helping keep me inspired and kind of getting up and doing it every morning. And just being in this space of healthcare and seeing through the last couple of years the role that technology played, how quickly things advanced. But now the position that we're in to continue to solve really challenging problems of workforce burnout, continuing, aging population, chronic disease, all this Molotov cocktail of situations that make it a really challenging place to work. I think that's something that I feel like bringing together those different parts and helping tell those stories and make those connections and help people learn about the space more too can play a part in seeing some of these innovations come through and in the end help more patients and help us be more happy and healthy. And it feels like I'm contributing something meaningful to society.
That is always good. We feel that too because we work in this space and think that, if we're helping people who help people, overall, we're doing good in the world, and there's not too many commercial lawyers that can say that they feel that way every day.
Absolutely.
So what sort of legal issues do you see coming up for, like, in the health tech space time and time again? I think we've talked about this on your podcast before.
Yes. Legal issues is one thing, but when I think about that, as soon as you said that, my mind went to more around the ethical issues because I think about some of these emerging technologies like artificial intelligence and and I guess then utilizing all of that data then brings a lot of those legal challenges around data security, cybersecurity, and who owns the data and what to do with it. That constant kind of battle between commercial opportunities versus clinical outcomes. So all of those things coming together, I think, are really interesting. The ethical things is interesting with artificial intelligence when it comes to bias and access and all of those kinds of issues too. So I feel like we could unpack that over a 6-hour podcast episode. But, like in terms of like those are really kind of front of mind right now. And I know of concern to clinic owners and to software startup, like a health tech startup founders and investors. It's these issues of ethics and how things play out is very much
really front of mind. Yeah. And then that, of course, is legally privacy as well comes into it in a big way, and confidentiality, those sorts of general medical legal issues.
In this industry where the information that we're dealing with is so important
and sensitive
to everybody and, has like kind of a key target from those doing nefarious things. So yeah, it's a challenging space.
Health tech is really growing in Australia, and it does tend to make healthcare more accessible. Is one of the reasons you're so passionate about health tech, that it does make healthcare more universally accessible.
Absolutely. I think technology has this great opportunity to make healthcare more accessible. You think about how telehealth, telemedicine, virtual care can enable those who might be a very long distance away from care to be able to receive care in the middle of the night or without having to travel across long distances, particularly for things that are unnecessary like follow-ups and things. I think that it's interesting reflecting on technology being an enabler of greater accessibility as opposed to, inhibiting access to healthcare, because some might think of technology being, we need to make sure it's usable for those who might not normally be used to or like using technology.
But
true. I think what we've seen, through the last couple of years as well is that a lot of people can pick up a phone or do a FaceTime call or a video call if it's easy to use, if it makes sense. So I think that puts the challenge to vendors to be able to continue to create solutions that feel as simple to use as a consumer device, even if it's hidden deep in the bowels of a hospital. When historically a lot of software and technology has not been built with the user in mind in terms of usability, and it's been vendors kind of creating things and chucking it over the fence saying, well, here it is. It functionally does what you wanted it to do. I think there's, tying together some of these points around co-design and working with clinicians about what they want is going to be really important to improve accessibility for healthcare through technology, because in the end, the end users of the solutions are often the clinicians. But also there's the one last point in relation to accessibility when it comes to healthcare, and that's more focused around people with a disability. And I think that's a really important one to unpack as well, and for vendors to be cognizant of, because I think of building solutions, and this just goes into healthcare more broadly too, being accessible for people with a disability doesn't mean just putting in a wheelchair ramp. There's much more, and it's a complex space to work in. I think that if we can get more people working in healthcare, be it technology providers or elsewhere, thinking more about, being accessible isn't just a tick box thing, but it's really understanding who you're trying to improve access for, then I think that's going to be beneficial for them.
And also understanding what they need. An example is I'm actually the chair of a board that helps people who are aging and people with disabilities access information. And we had a meeting with a board that we are in partnership with that solely work with people with disabilities. And somebody came and she was in a wheelchair. And I had always thought of our office as being wheelchair accessible because it has a ramp. Turns out the pitch of the ramp is too hard for someone to wheel a wheelchair up, and they need to be pushed. So I was so embarrassed, but that's why you can't just build a ramp and just expect anyone to be able to use it. And that's the same with all the solutions that health tech providers are looking at, or healthcare generally, as you say. Need to actually have someone try it out and give you feedback.
Yes, absolutely. And build with you. And I think that where we're hearing
Engage
more of
early.
these conversations within the ecosystem of vendors working with not just the hospital executives or not just the clinic owners, but being in there and witnessing for a while and just observing how things are done. And if you can go in like falling in love with the problem as opposed to just having a fancy solution that you're trying to find a use case for, then generally you'd be,
get a better result.
Absolutely.
So on that, you work with a lot of health tech startups. What is your number one tip for someone who's starting out?
Oh, I shouldn't have used my last, that one-liner about fall in love with the problem and not the fall in love with the problem to be solved, not just your fancy solution. Because I genuinely feel that, especially when you're so deep in the weeds, you might uncover a piece of technology and go, well, this is a really good use case for this particular situation. I think to extend on that, then I think of a lot of health tech startups. The founder might be clinical, and good solutions are often those where someone's experiencing a problem themselves, whether it's something being really inefficient or difficult to do. They're like, oh, if only there was a solution that exists to help solve for this. And then they create a solution. They're like, this is great. This will help so many more clinicians just like me. There are, in the GP space, 30-something thousand GPs. And I'm going to ballpark that a lot, everyone feels like everyone's got their own workflow. Sure, everyone bills, for a standard Medicare consult, but they don't do things the same. They have all unique workflows and nuances. So my big bit of advice would be to understand that workflow yourself, but then get more and more feedback as you go and get those use cases, but don't just build off one or a small handful of, clinicians' feedback on how a thing should work. Try and broaden that net as much as possible, because clinical workflows vary and needs will be different. And you're going to come across competing needs and competing suggestions all the time. So in the end, having those values and the core kind of understanding at the top, which will be your guiding light in deciding the problem that you're trying to solve in the first place, can hopefully help you navigate those little tricky points in building the solution.
Awesome. Love it. What have you done that you're most proud of in your business and work life?
think just being able to say that I'm a full-time podcaster is kind of like a nice thing. Like, and it's not, and I don't have to be Joe Rogan, which is really nice.
Yeah, that's a good situation.
And I guess extending on that too, I've built up a reputation of being the doer in many organizations. And that was a term that was used not by me, but by two other people I worked with beforehand, where, founders might do this and wave the hands and say, this is what we're going to do. Or, there'll be strategy documents and vision statements and everything. And then in the end, I'm like, someone's got to do, I'm the one that's got to drive all the doing of this. That's why I love working in operations and executing on stuff and making it happen. So I like being the making it happen. Yeah, right. I like being the making it happen guy and just actually doing stuff. And I think that that I'm holding on to. And, sometimes that can be a blessing and a curse when you're running your own thing and you try and, delegate out, but then you still end up being a bottleneck because you want to check everything. So I'm saying these things, not just saying that I've nailed it, but I'm also trying to instill some of these positive things in myself too. But I'm quite okay being the doer because I think when you get in and do stuff, you can learn about how to do things better yourself and not just take someone's word from her or base some assumptions on something that you did 10 years ago. So I'm always in the weeds getting the hands dirty and having a bit of fun.
I've got to let you go and do your school pickup.
Speaking of which,
one of the best things about running your own show too, having flexibility.
That's right. And speaking to wonderful people like yourself as well. So I think that, that's, and who knows where things will be at in the next 12 months, but maybe we'll have to have another conversation on the Talking Health Tech podcast.
6 hours, apparently.
Yeah, we could.
We're going to keep the conversation going in our private Facebook group, You Legal for Doctors. You're welcome to join us there.